We're going to now move to a video, a very short video, followed by an exciting new announcement on the stage on exactly the points you just heard about here. So please join me in thanking this fantastic panel, and check out the video.
Roslyn.
Hi.
How have you been?
I'm okay.
All right. You're ready to go to the field?
Yeah.
Any pregnant women?
Yeah, they are around 4.
All right.
Roslyn. Margaret.
Anaendelea aje?
Nzuri.
Okay.
My name is Roslyn. I'm a mother of 3 and I'm a community health worker. You deal with each person the way he or she comes. They know if I become sick, Roslyn is there for me.
There are millions of people who are looking for meaningful work, and they're ready to care for and look after their neighbors. We just need to shift our thinking about who we're supporting as health workers.
Investing in community health workers means ensuring that they have the right training.
I go to the training maybe once every month. We keep on motivating one another.
Imagine being asked to look after 500 people. You'd probably try to organize who needs what care and what services. What we try to do is make that all really easy with technology.
The advantage of the phone is to make sure you don't make errors, so it guides us.
They have an application that has profiles for every person, and they're connected to a clinic with staff that can support them.
We're co-designing this technology with community health workers so that community health can be delivered in a completely different level than before.
This is a way of giving an individual a livelihood. And what we have found is that community health workers have a high return on investment.
They've increased access to treatment for malaria, pneumonia, and diarrhea.
There's an increase in the number of children being immunized. We are also providing nutrition services as well.
As a result, more and more children are living and thriving.
We don't want to lose children. Now I'm trained and I count myself somebody who can help.
Every child deserves a 5th birthday, and community health can make that possible.
We can clap for that. So as Raj previewed, we're going to be announcing an exciting partnership here on stage. And I'll say, as a journalist helping to program an event, that's always a very welcome development. So thank you to the Rockefeller Foundation and Medic Mobile for picking this as the venue to announce this news. Please welcome back to the stage Naveen Rao from the Rockefeller Foundation, who you heard from earlier. And I'd also like to welcome Isaac Holeman, who's the co-founder and research lead at Medic Mobile. Thank you both.
Thank you.
I'm right here. Any order you'd like. So you heard earlier about this Precision Public Health Initiative, which Naveen and I actually spoke about when it was launched on the sidelines of the UN General Assembly in September 2019. So it's so exciting for me to be up here and see where is this leading and what partnerships have resulted. So Isaac can tell us a little bit more. You heard earlier about this desire to get data science tools in the hands of frontline health workers. And today we're going to learn more about Medic Labs, which is an effort to do that. So Isaac, can you tell us more about this partnership?
Absolutely. So Medic Labs is a new R&D unit that'll be incubating breakthrough ideas in data science and precision public health. We're launching with some catalytic capital from Rockefeller. And the idea is really to embed these new innovation efforts within the community health movement, which you saw about in the video we just showed. So there are a lot of partners that have been building infrastructure for this work, and the goal is really to make the opportunity of precision public health concrete for these health systems.
And for those who don't know, Medic Mobile has done this work on software and tools for community health workers for a long time now. So now with $3 million in support from the Rockefeller Foundation, can you talk about, what are the, speaking of scale, what are the pain points you've had in your own journey that this 3 million is going to help enable you to kind of push through and get to the next level?
Yeah, so, I would say that the context is that Medic Labs will be situated within Medic Mobile. We're a nonprofit organization that builds open source technology within 4 hard-to-reach communities. And we've been around about a decade. We're about 100 people globally, largest office in Nairobi. In a period where there has been a lot of pilotitis, there have been a lot of challenges. I also think that the field has been moving incredibly fast. Like, we've seen remarkable progress. The main open source project that we work on at Medic Mobile is called the Community Health Toolkit. And there are other folks in the room here today, as well as in that video, like Living Goods, like Muso, like a number of national governments that have made really important contributions to this toolkit. And so it's being used now at a pretty significant scale. We're supporting around 27,000 health workers. They care for an estimated 15 million people. And the software is supporting around 1.2 million care encounters every month. And so this is the kind of scale where new opportunities in data science and precision health become really relevant and really interesting. And so I wouldn't frame it so much as a bottleneck or a challenge that we're going to overcome. It's really that I think that there's sort of a foundation layer of digital health. It's open, it's being developed as a public good, it's ready for scale, it is scaling, it's being contributed to by governments, and we're starting to see these new opportunities in data science and precision health that we think we could unlock, other ways of improving care.
And I want to make sure we get to me, this announcement builds on what I'm seeing as a lot of momentum in terms of interest from the world of philanthropy in digitally enabled community health workers. We saw Raj Punjabi in that video, and Last Mile Health has announced some really exciting large-scale collaborations in this same space. So I want to talk about that trend, but first, Naveen, if you can kind of take us back to, you announced this, as you mentioned earlier, $100 million precision public health initiative. How did we go from that announcement to this partnership? We talked earlier about this event is all focused on the mechanisms of making partnerships happen. So can you just kind of take us through the story?
I'm glad you said story because I seem to be in the mood to tell stories today.
That's great.
So let me tell you the story of Toyota and Prius. Apparently in 1997, Toyota was approached, their management was approached by a group of engineers who wanted to work on a hybrid car because they thought environmental protection, and this is 1997, so you have to understand, they were a small hived-off unit. They were called the hippies. They were put off to the side. Nobody knew what this was, but yet somebody had the foresight to take a bet on them, saying that, okay, we need to have a group of people working on what we don't know where the future is. Fast forward to 2000, they launched their first Prius. It wasn't met with too much enthusiasm. In fact, there was one comment which particularly struck me was somebody wanted to genuinely know whether if it's an electric car and it's driving in the rain, is he going to get electrocuted? I mean, that was the level in 2000, and they sold 5,000 cars. Fast forward to 2018, it's the #1 seller. It is now, they sell 100,000 cars. And how it has changed, but nobody, when they started this unit as a moonshot, thought it would be where it is, but because of the green environment. So part of what our thinking at Rockefeller Foundation was, yes, if we are really truly believe in predictive analytic tools in the hand of frontline healthcare workers to make an impact, then shouldn't we be going to the ones who are doing the best job and giving them the chance to take these bets on what we don't know? Long-term, moonshots, what we don't know, and who better than Isaac and Josh and the Medic Mobile. So that is our story.
You mentioned the term moonshot, and that comes up a lot in my coverage, and a big interest from philanthropy, especially in Silicon Valley, to support moonshot ideas for global health and international development. But I want to bring it to Isaac, because Isaac, I know that Medic Mobile, while you're very much, one foot in the tech world, one foot in the global health world, and you bring these worlds together, you're also working in some very challenging contexts. Some places where you work, for example, have no internet connectivity. So can you just talk about, and I'm sure many in the room can relate, who are trying to bring tech to global health, how do you balance moonshot thinking and emerging tech with the reality of the context where you're working, where sometimes, those tools aren't going to work, or you have to design a bit differently for those contexts?
That's a really good question. My experience with moonshots is that we're fond about talking about them in the abstract, and then it's when somebody puts forward the specific idea, that's when they say, am I going to get electrocuted by that? And you face a lot of criticism, and it's hard to get things going. But, I would reflect on this challenge kind of in light of where we were around 2010 when we were getting started. There was this narrative then that you could build for the web and web applications, really exciting technologies, but we don't have connectivity in most of the communities that have the highest burden of disease. Mm-hmm. And so alternatively, you could build kind of clunky, antiquated desktop applications, or the mobile app space was emerging, but it was still pretty constrained in significant ways. And the idea was that you had to make a choice. Mm-hmm. Which is it? The future of web technologies, or the sort of severely constrained things? And we really felt like that was a false choice. And so we started working with what was at the time a very small open source community working on offline first design patterns. And so we started building web applications using web technologies, but where the default experience is fully offline. Mm-hmm. And you treat connectivity as something you get occasionally, and that enhances the experience when you get it. And it was slow going at first. I think we had a lot slower progress in the early 2010s because of the way we were working with these technologies. But it wasn't that many years later when Google started to make a big push on offline first, and the related idea of progressive web applications, where connectivity is a progressive enhancement. And we felt really validated, like these technologies are very exciting. Mm-hmm. And similar to what we heard on the last panel, if you focus on the hardest to reach communities and you really solve problems for them, those problems can be much more widely applicable. The solutions can be much more widely applicable. And so I think we're at a similar moment with precision public health. Mm-hmm. People are looking at what's happening in precision medicine, in the United States, and they're thinking, gosh, whole genome sequencing, that has got to be super expensive. And a lot of people feel like I've got to choose between doing something that's really innovative in precision medicine or something that really matters, mm-hmm. In hard to reach communities. And that's a false choice. Just accepting that would be a total failure of imagination. So I think we need to understand the concepts and the trends in the developing technologies that are enabling precision medicine, and we need to creatively reapply them to public health problems. And when we do that, I think like the wider lesson is that when you're faced with a false choice, there's an opportunity to design systems that transcend that choice, that make the choice irrelevant. And that's a very different thing than trying to balance, mm-hmm. than trying to go somewhere in the middle, or trying to optimize for which option should I choose from among a poverty of options.
So even
there's a lot of insight we can get. I'm sorry to interrupt.
No, please jump in.
There's a lot of insight we can get from Henry Ford. Apparently, when he was rolling out his T model, somebody asked him, why are you building all these cars? Mm-hmm. We don't have the roads for them. And he famously said, the demand for the cars will drive them to build the roads for us. Mm-hmm. And that's exactly what happened. He didn't wait for the roads before he put his cars out. He said the roads will come because of the demand for the cars.
Mm-hmm. Yeah, that's a helpful analogy.
And sure enough, they were different roads than we had used in the horse-drawn cart era.
That's right.
That's right. So,
Naveen, I want to ask you something. Speaking of something you brought up in the last session on financing, you were talking about the power of philanthropy as a convener. So with this Precision Public Health Initiative, it's not just the $100 million. What I was struck by, and part of why we spoke when this launched, is the tech partners you're working to convene. So I wonder if you can speak to how is that going? What more can you, through the Precision Public Health Initiative, and others in this room, funders and implementers, do to engage the tech community in solutions like this one?
So, and also it goes back to what we spoke in the first session, first panel, is that you have to be clear on what the ask is.
Yeah.
You cannot go to the private sector, in this instance, the big tech companies, without a clear, crisp ask of what is it, the role they can play, what is in it for them, how much risk is it, how much is it going to interfere with their day jobs and whatever doing. So that took a while, and when we realized there are some key places where they can come in, for example, they have talent, and they have a lot of talent and employees who want to do good. How do we tap into that? How can we make sure we can allow their employees to work on projects like this that will help them retain their talent and also attract the best and brightest? They have assets. How can those assets be put to use in global public health? But then there's the whole issue of privacy, and there's the whole issue of data sharing and security, and how do we address all that? There's some goods. I mean, they have money, they have goods, they can donate. So we needed to be very clear as we build this coalition, what do we expect them to be able to come in? And once you're clear, it's amazing how far the conversations have been progressing. So I've been here, and it's very encouraging to see how all these companies really do want to come into the fold.
I think that's a really important point and highly practical advice when it comes to partnership. You know, in my coverage of this space, I've talked with a lot of tech companies who are interested in engaging, but you can't imagine the amount of inbound they get with, we'd like to just come and discuss potential for partnership with Facebook or Google or Microsoft, name the company. And you know, they are looking to engage, but with clear asks. And I'm sure we'll get more insights on that later in the day.
I mean, we went through that pain to clarify our thinking and the ask, and it's paying off now because we're able to engage specific.
I want to get, go ahead.
Before we go on,
Yeah,
another
yeah.
conversation we've had about getting specific that I think is really helpful is there are a few different communities within private sector. You know, that's a big umbrella. And so you get a specific ask for a big tech company. That's going to be a little different than the specific ask you might get for a venture-backed startup. And actually, we're seeing a lot of software shops and design shops pop up in places like Nairobi and Dakar and Mumbai and Kathmandu. And they have a really cool role to play in this wider digital health ecosystem. They have a different cost structure. They have a different set of personal relationships and like local knowledge that enables them to play, I think, a really interesting role in an overall healthy ecosystem.
Agreed. Yeah, thank you for adding that point. With just a few minutes left, I do want to return to the point I was sort of previewing earlier that, again, to me, this partnership, you know, Precision Public Health and the launch of Medic Labs, which we're announcing today, fits into what seems to be a trend, a positive trend of philanthropy seeing an opportunity to support digitally enabled community health work. So I'm curious if you can talk about why are we seeing that momentum, and what lessons can this space offer to others in the room who maybe their focus isn't digitally enabled community health workers, it's something else, but they want to similarly find ways to engage philanthropy together with tech to really move the needle in a certain space. So is this a trend you're seeing, and what might the lessons be?
So eventually, I think whatever business and whatever industry you're in, you're going to be a digital company if you're going to survive. So you're going to be a digital company that also sells medicine. You're going to be a digital company that also, So this is the way, and if you really look at how industries have been disrupted, if you don't have a data science, digital play, I think you're going to be less. So that trend is happening, and I really do believe so. For health, it's really important. We are thinking of predictive analytic tools. We're thinking of the future. You know, just a memory flashes back. When I was in medical school 45 years ago, I remember my professor of obstetric gynecology saying, you cannot predict which woman is high-risk pregnancy. There's no way to say which pregnant woman is going to die and which one won't. So you have to treat all your patients, all your pregnant women as high risk. That was great 45 years ago. But I'm asking myself today, Netflix knows which movie I'm going to watch even before I know it. And the weather forecast app is going to tell me if it's going to rain on my head in the next half hour, wherever I'm standing in the world. With that kind of predictive analytics, do I still believe that if I have 10 pregnant women, I'm not going to be able to predict who's high risk and who's it? And shame on me if I'm still not bringing that to this. So I really feel the trends are there, the questions are there. All you have to do is ask yourself on all the paradigms that you were fed before the data technology push, and are they relevant today, and are we still not picking up where we should? So that is pertaining to everyone here. Whatever you're doing, ask yourself, are we still caught up in the old paradigm where there's a whole new world out here?
Great.
I would add to that, we're kind of bridging this trend with digital with the movement for community health. And if I could make a book recommendation to the audience, we've been reading Moonshots. And it's about crazy ideas that are dismissed by their peers, the creators dismissed as unhinged. And yet these ideas can become incredibly important. And it's an engaging read, and he shares a few good ideas. And one of them is this idea of 3 deaths, that really important ideas typically get killed repeatedly. And some of them just stay dead. But the ones that do end up becoming really important, somebody chooses to revive them. And with community health, we've had models of extending care beyond facility walls for 100 years. And actually, in the late 1970s, there was an enormous swell of political support for placing the community health worker at the center of the mandate of health for all. And there's a long history to the social and economic circumstances that led to that movement getting shut down in some ways. And then there's been decades of effort that's gone into reviving it. So for me and a lot of my community partners in health has played an important role in mentoring this movement.
Yep.
And there have been organizations that have formed specifically to bring this movement together, like the Community Health Impact Coalition. And then you have this kind of social glue where people, you're working with peer organizations in the movement, and you really try to care for one another and support each other. And when you take on something like a moonshot or another new trend like digital health, you're saying, can we do a moonshot that will have positive tangential spillover for the movement? And so it can take decades of work to get your good idea revived. And I think that's what's happened for this moment we've seen in community health.
Well, I want to thank you both for bringing this partnership to the stage. I think the community health space, and with this effort underway to support digitally enabled community health work, it's a really good example of partnership across sectors. So I'd encourage you to find Naveen and Isaac throughout the day and look for opportunities for partnership. Please join me in thanking our panelists.
Thank you.
Thank you both.